Hi, my name is Lauren Bell, and I'm a PA student here at Damon, and today I'm going to be doing your follow-up visit. Do you consent to being filmed for this video?
Yes.
Okay, and what is your name?
John Smith.
Okay, and what is your date of birth? Or how
I'm
old are you?
50.
And you're here today for a follow-up for GERD, is that correct?
Yes.
Okay. Since your last visit, have you had any hospitalizations, ER visits, or surgeries?
No.
Have you had any diagnostic testing, major accidents, or seen any specialists?
No.
Okay. Okay, do you know when you were diagnosed with your GERD?
About a year ago.
Okay. And are you currently taking any medications to treat your GERD?
Omeprazole.
Omeprazole, okay. And how long have you been taking the omeprazole for?
About 6 months.
6 months, okay. And do you know the dosage on that?
It's 20 milligrams once a day.
Okay. And that's a tablet?
Yes.
And you take that by mouth?
Yes.
Okay. Okay, and are you compliant with that? Are you missing any doses for that?
I'm
Okay.
compliant.
Are you experiencing any abnormal side effects with that have been bothering you?
No.
Okay, so other than the omeprazole, are there any other medications that you have used for your GERD in the past?
I've used Tums
Tums, okay,
and Pepsid.
and Pepsid. Okay, and then how long did you try each of those?
About 8 weeks.
For each of them?
Yeah.
Okay. And were they just not really enough for you? They weren't helping you with your symptoms, or did you have to stop taking them due to side effects?
No, it was just minimum relief for
Okay.
both of them. They weren't really working that well.
Okay, and have you ever gotten any diagnostic testing done for your GERD? Like, for example, like an endoscopy where they put a scope down your throat?
No.
Have you ever seen any specialists for GERD? For example, like a GI doctor?
No.
Okay, and if you were to explain the stability of your GERD symptoms, would you say it's pretty well managed, it's kind of out of control?
It's gotten much better since I've started taking the omeprazole.
Okay, much better with the omeprazole? Good.
Mhm.
So if you were to rate your heartburn on a scale of 1 to 10, 1 being no heartburn at all, 10 being the worst it's ever been, how would you describe it?
About a 2.
A 2, that's great, okay. And have you found any limitations in your daily activities with the GERD, with diet or positions, anything like that?
I'm able to eat a little bit more spicy foods, but it's still minimum just for precaution.
Okay, okay. Okay, next I'm just going to ask you about some symptoms, and you're just going to answer yes to no to have been ever experienced the following.
Okay.
Have you had any weight gain or weight loss?
No.
Have you experienced any change in your voice quality?
Mm-mm.
Have you had any sore throats at all or burning in your throat?
Just when I have the acid reflux, it burns a little.
Any trouble swallowing your foods?
No.
And then in your chest, have you experienced any chest pain, chest pressure, palpitations, feeling your heart racing?
Not really, no.
Okay, and then have you experienced any nausea or vomiting?
No.
Constipation or diarrhea?
No.
Indigestion or heartburn?
Yeah.
But better.
Yeah,
Okay.
oh, yeah, since medication, much better.
Any difficulty or painful swallowing? Okay. Any blood in your vomit or blood in your stool?
Mm-hmm.
Any black tarry stools?
No.
Okay. Any change in gas patterns, stool frequency, or stool color? Any abdominal pain?
No.
And have you had any change in appetite?
No.
Okay, next I'm going to go through your past medical history. Other than the GERD, have you been diagnosed with any other medical conditions?
Hyperlipidemia.
Hyperlipidemia? Okay. When were you diagnosed with that?
2020.
2020. So just the GERD, hyperlipidemia, any other medical conditions? Okay. What about surgeries? Have you ever had surgery before?
I had my appendix out.
You had your appendix out?
Yeah, long time ago.
Okay. Do you know what year that was or how old you were?
I want to say around 14.
Okay. And did you have any complications with the surgery?
No.
Any other surgeries that you've had in the past?
Mm-mm.
Okay. Next, we're going to go over your medications. So we already talked about the omeprazole. Are you taking any other medications?
Atorvastatin.
Atorvastatin?
Yeah.
And do you know the dosage on that?
20 milligrams.
Okay. And that's by mouth?
Yeah.
And that's 1 tablet?
Yeah. A day.
And you take that once a day?
Yeah.
Okay. And are you compliant with the atorvastatin?
Mhm.
Any other medications you take?
Mm-mm.
Do you take any vitamins, herbs, over-the-counters, or supplements?
No.
Okay, and then are you allergic to any drugs?
Sulfa.
Sulfa, okay. And what happens when you take sulfa? Like what kind of reaction do you have?
Break out into hives.
Hives, okay. Any other allergies to drugs?
No.
Okay. Okay, next we're gonna go over your family history. We can start with your mom. Do you know anything about your mom? Is she alive or deceased?
She's alive.
And how old is she?
70.
And has she ever been diagnosed with any medical conditions?
Not that I know of.
Okay. And what about your dad? Alive or passed away?
He's alive.
And how old is he?
72.
And does he have any medical conditions? What does he have?
HTN and GERD.
Okay, do you have any siblings? Brother or sisters?
Sister.
A sister. How old is she?
She's same age as me. We're twins.
And has she ever been diagnosed with any medical conditions?
Depression.
Depression? Okay. Okay, any other siblings?
No. No other siblings.
Okay. And then do you have any children?
A daughter.
A daughter. And is she alive or passed away?
She's alive.
How old is she?
22.
22. And does she have any medical conditions?
No.
Do you know anything about your mom's parents, your maternal grandparents?
Oh no.
No?
Yeah.
Yes?
Yeah.
Okay.
Yeah,
Do you know
my
anything,
yeah, I do.
do you know anything about your maternal grandmother?
Yes.
Okay. Is she alive or passed away?
She died.
How old was she when she passed away?
90.
Okay. And what did she pass away of?
MI.
And anything about your maternal grandfather?
He died.
Died. How old was he when he passed away?
85.
Okay. And what did he pass away from?
Alzheimer's.
Alzheimer's. Okay. Sorry to hear that.
Thank you.
And what about your father's parents, your paternal grandparents?
I never met them.
No, you don't know anything about their
No.
lives? Okay, no worries. Okay, family history, good. Now I'm going to ask you about a little bit about your social history. So, what do you do for work?
I'm a truck driver.
Truck driver? Okay. And then we'll talk a little bit about your diet. What would you say your daily diet consists of?
I like spicy foods 2 times a week,
Okay.
but less since GERD,
Okay.
obviously.
What about your caffeine intake?
Like 1 cup of coffee a day.
A day?
That's about it, though.
Okay. Do you currently or have you ever smoked or used any other tobacco products?
No.
What about alcohol? Do you consume any alcohol?
Yeah.
What do you drink?
Beer.
Beer? How often are you drinking beer?
Like 1 a day.
1 per day? Okay. Do you use any recreational drugs?
Mm-mm.
And are you exercising at all?
A little. I walk like 30 minutes, like 3 times a
Okay.
week.
Okay. And then how would you explain your stress levels?
Minimal.
Okay, next we're gonna talk a little bit about your health maintenance and stuff. So when is the last time that you had like an annual physical exam? Or saw your primary care doctor?
Like 6 months
6
ago.
months ago? Okay, and have you ever had your hepatitis A and B vaccines?
Okay.
Do you know when you had those?
When I was a baby.
Okay. And then have you ever had your colonoscopy done? Okay, when was that?
3 years ago.
Okay. And anything abnormal pop up with that?
Nope.
Do you know when your next one is?
I think 10 years.
Okay, thank you.
You're welcome.